It's a common problem, and it happens to both men and women. More common in men, hernias can be painful and need to be fixed in the OR.
We've got this large direct hernia defect right here, just bulging way up in the floor. Y'all can see that, I'm sure.
Body tissue starts poking through a tear or defect in the connective tissue, and it has to be pushed back through and the hole stitched closed. You can be born with a defect, or stress from lifting on the job, or a previous surgery can cause the weakened area, or something unusual.
In New Orleans, the trombone players, for example, are famous for getting hernias because they're constantly stressing their abdominal wall tissues.
Surgeon Dr. David Treen has been repairing hernias a little differently. Several years ago, the FDA approved this mesh patch for the defect. It covers the under and top side of the hole instead of stitching it closed. Then new tissue grows through it.
But we now have learned over the last 10 to 20 years, we've learned that replacing the defect with a synthetic mesh device is much better for the patient in terms of postoperative discomfort and in terms of reducing the incidence of recurrence of the hernias.
But the Proline hernia system patch has been slow to catch on. So surgeons from around the country come to West Jefferson Medical Center to see how it's done.
We've got actually a larger hernia on this side. So you can see this really just bulging up way.
While Dr. Treen repairs the hernias in case after case, doctors sit in the hospital auditorium and watch the surgery live. Dr. Treen explains every step. Visiting doctors ask questions. He has even broadcast surgery live on the internet and closed-circuit TV in Central and South America, and to Japanese doctors who watched at the wee hours of the morning. The patch has no record of migrating to other areas of the body, nor has it been rejected.
The results are amazing. The recurrence rates are lower than any other product that we have seen for inguinal hernia repair. The costs are cheaper than many other operations. The return to work is very rapid. Patients are able to get back to normal activities whenever they feel up to it. It's no longer this 6 or 8 weeks sitting at home not lifting a pencil.
Meg Farris, Eyewitness News, Medical Watch.